stretching the sciatic nerve. Sometimes, some people, if you do this and you do cord tension test and the suboccipitals are going, you've got a work cut out for you because their cord tension's so high. So this is part of my pre-adjustive things. I'm talking to someone going, so what I'm going to do is, don't know if you realise, but your brain is connected to everything, and the messages start here and they come down the spinal cord and they go out not just to your muscles and bones, but they go into your organs and glands all through here. So I'm actually getting a sense whether she's okay with touch. And then I'm doing flexion. Some people, when that feels like wood and they're like, they're on the table like this, I'm like, shit, I've got some work to do here. So I'll come down the very end and I'll be like, all right. And I'm just stretch. And when you can stretch the spinal cord, and this is a good time to talk about, we're talking about outcome measures. With kids, every baby should be able to touch their toes to their forehead with ease. And strictly speaking, if you've got a good spine, you should be able to touch your toes on your knees, your head on your knees. Okay. And you should easily be able to fold your spinal cord. And none of us here would be able to do that, so that's why we need to get adjusted so often. That's why we need to keep our cords flexible. That's that's the reality, right? So if the cord tension is that high, and I put stretch on the sciatic nerve from here, and her suboccipitals are yanking, then she's going to need a lot of adjustments. She's going to need a lot of unwinding of her nervous system. In the same way that when I start putting lateral cord stretch in, this has gotten better throughout the day, right? Mm-hmm. So see how this is pre-adjustive, is telling me whether we've got someone with good cord flexibility, good plasticity, or terrible. I could do all these things to see just how good, and that's our outcome measures really. We should be able to go, I know you think you're coming for this, that, and the other, but your cord tension is so high, your amplitude is so high, your body's in distress. Why is that? And same with this woman. You go, okay, so if she adjusts really well in the thoracics, and what's going on here? And is it some sort of abuse or trauma? Did you fall off a horse and land on your tailbone? Did you break something? Have you had, what on earth has caused you to hold this much distress and trauma in here? And so I can do lateral. And if she's not open to adjustments, or she's if she's too sensitive for you to even do this, then maybe you've got to start stretching. Like I'm stretching into the dura from distal, work my way up. Some people you do this, and their neck goes into a massive extension because when I'm tractioning on the sciatic nerve here, that's pulling all the way up into there. And if there's tightness somewhere in here, subluxation, then that's going to give me a good idea of what I've got to deal with. And I do this. Some people, that literally comes up like that because they're so tight. And then I've got to go, is that the hip? Is that sciatic nerve here? Is that SI joint? Is it lumbar? What is it? And then I can isolate the hip, check whether it's hip. And on someone like that woman, you might find that a broad Logan contact here is going to get close enough. And then you could just sweep in there and say to her, can you feel that in your head? Can you take your mind in there? Are you okay with that? And then come on this side. This is a really safe way to get closer to the anterior aspects of the pelvic floor. And you push your way with the knee. There'll be a whole lot of... So I'm firing up through the whole sacral plexus here. And then I would be like, are you okay with that? Are you okay with that? Are you okay with that? Press and hold, trying to get some sort of relay through the sacral plexus that might let her unwind all that tension.
Yep. Starting broad.
Start from the periphery and work your way up, because if it's... It's one of the reasons why I start with people face down. I start at the periphery and I work my way up to the, the brain stem, because that's where the most complex, most difficult stuff is. And if I can unwind... In fact, that's a good point to talk about long track. So there is a lot of kids will be brainstem overwhelm. They'll be hypertonic, colic, post-birth trauma, Can I have you back in, actually? So what I get parents to do is a long track unwind. So this is something parents can do at home, is you get a cloth or a sleeping bag and put your arms by your sides. So you really wrap the child, take it back to the womb, right? And I'm going to like press. Now you have to press deep into the deep tracks. Relax your legs down. And we're going to imprint calm. This is how you teach the nervous system calm. And then I slapped your feet to fire your nervous system up. But when a child is high amplitude, high stress, you've got to press into the deep tracks, and you've got to teach calm. So this is how we...
Feels great.
It feels amazing, right? So if you imprint your children from a young age with calm, then I'm teaching you to send anxiety, stress, overwhelm from the center to the periphery. And so in time, you can teach your children when they're nervous and stressed to do this to themselves, right?
That's what it feels like. It feels like it's just like washing.
So it's de-amplifying, it is desensitizing, it is calming. Now, if I introduced my lullaby, your dad loves you, he thinks you're amazing, or then I'm also imprinting calm into song, and that's what parents do innately anyway. But I'm actually going to do this, and with my kids who are in their 20s now, I can literally, and I do this regularly as an experiment. So you do it until their eyes roll back in their head, and there's that, and you go, that's it. And you can imprint the same calm voice, because that's part of me teaching you, so that in the future, if I just use my calm voice, you're going to start flipping back into that imprint, right? So the compressive thing is good for bed linen, like it's a good way to do it, teaching them calm. And then you can be driving along in the car with your kid, and you go, how was your day? You put your arm on their leg and you just squeeze. As long as you're going down the body, you're going to teach them calm, right? You're going to reintroduce calm. And if you're out in the shops and you go, I know you're upset, I know, but what you've got to do, come back, come down, especially these autistic kids, you can just squeeze down. And then even like if I did this to you, I've got training in your nervous system to peripheralize stress.
That's so cool.
Isn't that cool? So that's teaching parents how to introduce long track calming. This is how we chiropractors teach kids calm. And then forevermore, if I do this to my sons, like, hey, how you going? And they just, it's a whole unwind. And it's, like you fucking, and then the same thing, with, again, when you're going down the body, you'll start to see how naturally we do that to ourselves anyway. You can just peripheralize that stress.
I do that a lot, actually.
Yep. So but again, if you do it through the deep tracks, it will work. Now, if I use soft touch, it's annoying to the nervous system, and it's actually irritating. So you have to remember to step. You have to step in deep and firm in order to make sure that the long tracks are down going. Isn't that amazing?
Great.